Hello everyone, I'm Dr. Apoorva Kulkarni. I'm a consultant clinical and radiation oncologist at Continental Hospitals, Hyderabad. And today I'm going to be answering a few of the most commonly asked questions on breast cancer. So breast cancer is basically an abnormal growth of cells in the breast, most commonly in the milk producing glands or lobules. And coming to the question of how prevalent breast cancer is, breast cancer at present is one of the most common cancers in women in India, both in the rural and in the urban areas. Statistics say that about 1 in 8 women will develop breast cancer in their lifetime. So we all need to be aware about breast cancer. So the most common factors, risk factors for developing breast cancer are age, there can be some amount of genetic predisposition, lifestyle factors and hormonal factors as well. So generally the risk of developing breast cancer increases with age, but nowadays we are seeing a trend towards the lower spectrum of the cutoff for the age group of breast cancer. And it is also due to factors like early onset of puberty, late age at menopause. So what this does is that it exposes the woman to increased estrogen in her lifetime, which is a contributory factor for breast cancer as well. And then there are factors such as late childbirth and not breastfeeding the child, and lifestyle factors which are very important, which include smoking, excessive alcohol consumption, excessive consumption of red meat, fatty foods, not having a healthy lifestyle, not exercising, being overweight. All these are contributory factors for breast cancer. In some women there might be a genetic predisposition as well, which increases the risk of breast cancer, but this is found in only a small percentage, about 5 to 10% of women. So to reduce the risk of breast cancer, as we already discussed, the major factors would be modifying the lifestyle. So cutting down on smoking, limiting alcohol intake, maintaining a healthy lifestyle, being active and exercising regularly. So for exercise to be a lifestyle modifying factor for cancer, you need to exercise at least 30 to 40 minutes each day for about 3 to 5 times per week, and that is when it is going to be helpful. And then there are factors like hormonal replacement therapies and all, which can obviously be discussed with your doctor. So screening is a test which has to be done, which is done even before the onset of symptoms or signs. So it is done in normal people who do not have any symptoms or signs, but you still go for this diagnostic test. That is what is called a screening test. And for breast cancer, the best and sensitive test for screening is a screening mammogram. So mammogram is just like an X-ray of the breast. Okay, so it is recommended for all women above 40 years of age, and it is done every year. So breast self-examination is a systematic and regular palpation of the breast by the woman herself. So it can be done standing in front of a mirror, sitting or lying down position, whatever is comfortable for you. So here the foundation is to basically be aware of your breast, to be aware of how they usually look like and feel like. So if there is any slight abnormality you notice at any point of time, then you could seek a doctor's help. So when we are doing a breast self-examination, the major foundation would be to look for if there are any changes in the size and shape of the breast, the feel of the breast, or if there is any change in the skin overlying the breast, if there is any nipple discharge, or if there is any redness or dimpling of skin. Also look for the position of the nipple, if it is inverted. You might want to look for all of these signs during a breast self-examination. So the most common symptom or sign that a woman with breast cancer presents to us is the symptom of a swelling or a lump in the breast. Although most of the breast lumps are not cancerous, it is very essential to get it checked and diagnosed by your doctor to confirm that it is so. Other than that, you may have changes like bloody nipple discharge, there can be redness on the skin overlying the breast, there can be itching. Sometimes what happens is that you do not find any swelling or lump in the breast, but there is some swelling or lump in the underarm or armpit area. So that also could be a sign of breast cancer. So if you notice any of these signs, it is very important to see your doctor promptly. So women with breast cancer generally do tend to experience emotional anxiety, fear, and there might also be a component of depression, and there are a lot of practical challenges right from beginning to choose the treatment, whether it's surgery, chemotherapy, hormonal therapy, radiation therapy, and even with the surgery to conserve the breast or to get it removed entirely. And once she gets into the treatment, there can be difficulties in managing the side effects of treatment. There can also be a lot of other challenges like striking a family and work-life balance. So during this entire time, crucial support network support network of friends or family is absolutely crucial. Breast cancer is very much treatable, and the earlier the diagnosis, the better are the cure rates as well. So for someone who is being detected in stage 1 breast cancer, the cure rates are as high as 90 to 95%. Having said that, breast cancer is very much treatable in all the stages, right from stage 0 to stage 4. And with the newer advancements, the technologies, the modern medicine we have in place, it is very much treatable. So breast cancer is not specific only to women, it happens in males, men as well. Unfortunately, breast cancers in men tend to be diagnosed at a later stage and in aggressive forms, because first, men are not aware that it could be breast cancer, and because of lack of fatty tissue, the cancer tends to spread aggressively into the muscles underneath the breast. So it happens like that in men, but it is comparatively rare. It happens about like 1%, but males also do tend to get breast cancer. Breast cancer is also seen in men, although it is not as common as it is seen in women. It accounts for about 1% of cases, but men also tend to get breast cancer, and unfortunately the breast cancer in men tends to be more aggressive. Firstly, because of a lack of awareness that men could also get breast cancer, and it is also because of the lack of the fatty tissue in males. So the cancer tends to spread aggressively into the underlying chest wall muscles. So men can also get breast cancer, they just have to be aware. Breast cancer is a very prevalent disease in India as of now, and also there is a higher trend to develop breast cancer in India as compared to the West. So all of us, all the women out there should be aware of this disease, and if you are about 20 years of age, start with a breast self-examination and seek a doctor's help whenever you notice any changes or abnormalities in the breast. And if you are above 40 years of age, please do get a screening mammogram. Thank you.